I'm Dr. Vanessa. I'm here to talk about breast lumps, the good, the bad, and the in between. What every woman needs to know. As a breast radiologist, I am privileged to be part of a healthcare team that helps women understand and manage breast lumps. Breast lumps can be a source of anxiety and fear for many women, and it is important to know that not all lumps are bad news. Some are benign and require no treatment, while others may indicate a serious condition that needs immediate attention. My goal in this webinar is to provide women with the information they need to better understand breast lumps so that they can make informed decisions about their health. I want to reassure women that not all lumps are cancerous and that early detection is key to successful treatment. By sharing my knowledge and expertise, I hope to empower you to take control of your breast health and advocate for yourselves. What are breast lumps? Breast lumps can be a source of anxiety for women, but not all lumps are cancerous. As a breast radiologist, I'm passionate about empowering you to understand the different types of breast lumps and their causes. I will discuss benign, indeterminate, and malignant lumps and the importance of routine breast cancer screening and early detection in improving outcomes. I will also cover the various diagnostic tests and procedures used to determine the nature of breast lumps, such as mammograms, ultrasounds, and biopsies. My goal is to provide women with the information you need to take control of your breast health, advocate for yourself, and make informed decisions about your health care. By emphasizing the importance of routine screening and early detection, I hope to encourage you to prioritize your breast health and make it a regular part of your healthcare routine. Early detection truly saves lives, and by staying informed and proactive, you can take charge of your breast health and improve your outcome in the event of a breast cancer diagnosis. First things first, I'd like to talk about the anatomy and be familiarized with the breast anatomy. The breast is composed of both fatty tissue, which is the gray part of this mammogram example, and the glandular tissue, which is the white or the bright part. The proportion of each fatty and glandular tissue varies among women and can also change over time due to factors such as age, hormonal changes, and pregnancy. Fatty tissue is mainly composed of fat cells and has a lower density than glandular tissue. Glandular tissue is made up of milk ducts, lobules, and connective tissue. The amount of glandular tissue present in the breast determines the ability to produce milk during lactation. The composition of the breast tissue can impact breast density, which is an important factor in breast cancer screening and detection. So again, this is an example of a breast anatomy. This is a mammogram example and the ultrasound example. The glandular tissue is the white or the bright part. Fatty tissue is the gray part. And this is the muscle on the ultrasound. Again, an ultrasound example. This is the skin, the glandular tissue, the fatty tissue, the glandular tissue, the retroglandular fatty tissue, meaning the fatty tissue at the back of the glandular tissue, and the muscle. The different types of breast lumps are benign, indeterminate, and malignant lumps. This presentation aimed to provide you with the knowledge and understanding necessary to make informed decisions of your breast health and take control of your health care. So what do I mean by benign breast lumps? Benign breast lumps are non-cancerous growths in the breast tissue. These lumps are common and can be caused by a variety of factors such as hormonal changes, fibrocystic changes, or trauma to the breast. Benign breast lumps can vary in size, shape, and texture and are usually painless. I will show you examples of benign lumps later on the slides. Although benign lumps are not cancerous, they should still be evaluated by your GP to determine the appropriate management plan. In some cases, monitoring or removal of the lump may be recommended to ensure the lump does not grow or cause discomfort. What is a palpable lump caused by a ridge of breast tissue? Sometimes a ridge of fibroglandular breast tissue can present as a benign breast lump. Fibroglandular tissue is a dense glandular tissue that is common in women of childbearing age. This is an example of a palpable abnormality in the left breast, which shows a very thickened fibroglandular tissue compared to the right side, which is very thin. Fibroglandular breast tissue can sometimes form a palpable ridge in the breast tissue, which may be mistaken for a lump. However, it is important to have any new breast lump or changes in the breast evaluated to determine the cause and appropriate management. What are benign breast cysts? Breast cysts are fluid-filled sacs that can develop within the breast tissue. They are common and can occur in women of all ages. Breast cysts can vary in size and number and are typically benign. They can be single or multiple and may feel like a lump or a mass in the breast tissue. Most breast cysts do not cause symptoms, but larger cysts like this one can cause breast tenderness, pain, or discomfort. Breast cysts can be diagnosed through a breast ultrasound like this one or mammogram and may require further evaluation through a needle aspiration or biopsy to confirm the diagnosis and rule out cancer. So this is an example of a benign breast cyst, which demonstrates a well-circumscribed margin. Treatment of breast cysts may include monitoring, drainage of fluid like this one. This is defined needle aspiration of the cyst or removal of the cyst. In most cases, breast cysts do not increase the risk of breast cancer. What is a benign fibroadenoma? A fibroadenoma is a common benign breast lump that is composed of glandular and fibrous tissue. Fibroadenomas can occur at any age, but are most commonly found in women under the age of 30. They typically feel firm and rubbery and can move easily within the breast tissue. Fibroadenomas are not usually painful but may cause discomfort or tenderness. They are typically diagnosed through a breast ultrasound like this one or a mammogram and may require further evaluation through a needle biopsy to confirm the diagnosis and rule out cancer. This is an example of fibroadenoma under ultrasound, which shows a well-circumscribed margin. Another example of a fibroadenoma in a patient with breast implant, and this is the breast implant. Again, showing well-circumscribed margin. Treatment of fibroadenomas may include monitoring or removal of the lump, depending on its size, growth rate, and location. Most fibroadenomas do not increase the risk of breast cancer, but women who have multiple or complex fibroadenomas may be at a slightly increased risk. This is an example of a fibroadenoma needle test. This is a vacuum-assisted excision removal of a fibroadenoma under ultrasound guidance. What is an accessory breast tissue? Accessory breast tissue is a term used to describe breast tissue that develops outside of the normal breast area, often in the underarm, like this patient. This is an example of an accessory breast tissue in the armpit, or it can be found in the chest region. This can occur in both men and women and is caused by variations in the normal embryological development of the breast tissue. Accessory breast tissue can vary in size and may develop during puberty, pregnancy, or lactation. It may also become more prominent during menstrual cycles or hormonal changes. Hence, I see women having accessory breast tissue with on and off pain or tenderness. In some cases, accessory breast tissue can form a palpable lump or mass and can cause discomfort, tenderness, or swelling. While accessory breast tissue is typically benign and not associated with an increased risk of breast cancer, a new lump or changes in the breast tissue should be evaluated to determine the cause and appropriate management. Again, another example of a accessory breast tissue. This is the area of tenderness of this patient, which shows an accessory breast tissue, and this is the normal side on the right side. What is a breast lipoma? Breast lipomas are benign tumors made up of fat cells that can develop within the breast tissue. They are rare, but can occur in people of any age. Breast lipomas typically feel soft and movable, similar to other lipomas found in the body. They are not usually painful, but can grow to be several centimeters in size and become noticeable or cosmetically concerning. All breast lipomas are typically benign and not associated with an increased risk of breast cancer. Any new lump or changes in the breast tissue should be again evaluated. In most cases, breast lipomas do not require treatment unless they are causing discomfort, growing rapidly, or are in a location that may interfere with normal breast function or breast cancer screening. This is an example of a lipoma situated superficially just underneath the skin, and it is well circumscribed. What is a sebaceous cyst in the breast? A sebaceous cyst is a common benign skin lump that can develop on the breast or other parts of the body. It's like a pimple. It occurs when the sebaceous gland, which produces oil to lubricate the skin and hair, becomes blocked and cyst forms. Sebaceous cysts can feel like small, firm bumps beneath the skin and can be movable. They're not usually painful, but can become infected or inflamed, causing discomfort or redness. This is an example of a sebaceous cyst situated just underneath the skin. And this is an example of an infected, ruptured sebaceous cyst situated on the skin. which needs um, which needs review by the GP and most likely surgical excision. While sebaceous cysts are typically benign and not associated with an increased risk of breast cancer, any new lumbar changes in the breast tissue again should be evaluated. In some cases, a subdermal sebaceous cyst may be mistaken for a breast lump or mass like the one in this example, especially if it is located near the breast tissue. A mammogram or ultrasound can be requested by your doctor to rule out any other causes of the lump and ensure it is not breast cancer. If the lump is confirmed to be a sebaceous cyst, it can be surgically removed or drained if necessary to relieve symptoms or prevent reinfection. What is a breast abscess? A breast abscess is a painful, pus-filled lump that can develop in the breast tissue. It typically occurs as a result of a bacterial infection, often related to breastfeeding, nipple piercing, or a cracked nipple. The infection causes inflammation and swelling in the breast tissue, which can lead to the formation of a painful abscess. Breast abscesses can be accompanied by symptoms such as fever, chills, redness, and warmth in the affected area. They may feel soft or firm to the touch and may be tender or painful. It is important to seek immediate medical attention if you suspect you have a breast abscess, as prompt treatment can help prevent the infection from spreading and causing further complications. Your doctor may recommend antibiotics to help clear the infection, or it needs to be drained through a small incision or with a needle. In some cases, surgery may be necessary to remove the abscess and surrounding tissue. Breast abscesses are not usually associated with an increased risk of breast cancer, but any new lump or changes should be evaluated. This is an example of a breast abscess which I drained using a vacuum-assisted needle. What is a benign fat necrosis in the breast? Fat necrosis is a benign condition that can occur in the breast tissue, usually as a result of trauma or injury to the breast, such as a seatbelt injury or surgery. It can also occur spontaneously without any obvious cause. Fat necrosis occurs when the fatty tissue in the breast dies, which can cause the formation of a firm, painless lump. Fat necrosis can be accompanied by symptoms such as skin changes, including redness and thickening, and breast tenderness or discomfort. In some cases, a lump may feel hard or irregular and may be mistaken for a breast cancer. This is an example of a fat necrosis secondary to seatbelt injury. In most cases, fat necrosis does not require treatment and will resolve on its own over time. It is a benign condition and it's not associated with an increased risk of breast cancer, but any changes in the breast tissue again needs to be evaluated and needs to exclude breast cancer. What is a breast scar tissue? Breast scar tissue and skin thickening can occur as a result of injury or surgery to the breast tissue. Scar tissue is a fibrous tissue that forms at the site of an injury or surgical incision as part of the body's natural healing process. This is an example of a thickened skin due to scarring. Breast scar tissue and skin thickening can also occur in response to radiation therapy for breast cancer. It can cause changes in the breast tissue and skin, including thickening and scarring. If you notice any changes, such as skin thickening or development of a firm lump, it's important to see your doctor, and your doctor may perform imaging tests such as mammogram or ultrasound to evaluate the breast tissue and determine the cause of changes. Post-surgical scarring can occur in the breast tissue after surgery, such as lumpectomy or mastectomy for breast cancer. Scarring is a natural part of the healing process and can occur at the site of any surgical incision. Post-surgical scarring in the breast tissue can cause changes in the breast appearance, such as skin dimpling or puckering, and may cause discomfort or pain. Scar tissue can also form in the breast tissue and cause a firm or hard lump. If you had surgery and notice changes in your breast tissue, such as skin dimpling, puckering, or development of a lump, see your doctor for a proper diagnosis. You may need a mammogram and ultrasound to evaluate the breast tissue and confirm that there is scar tissue. What is this lump that I can feel in my armpit? A reactive axillary lymph node is a lymph node located in the armpit or the axilla that has become enlarged, like this one. This is in response to an infection, inflammation, or other stimuli. I see a lot of these reactive lymph nodes in patients after their COVID infection, COVID vaccine, or flu vaccine. This is an example of a reactive lymph node, an enlarged lymph node situated superficially in the armpit. And this is a normal looking axillary lymph node. Lymph nodes are part of a body's immune system and act as filters for foreign substances such as bacteria, viruses, and cancer cells. When the body is fighting an infection or inflammation, lymphocytes or white blood cells and other immune cells gather in the lymph nodes, causing them to enlarge. Reactive axillary lymph nodes can occur in response to a variety of conditions such as infections of the breast, arm, or hand, as well as autoimmune disease or cancer. If you notice that you have an enlarged, tender axillary lymph node, it is important to see your doctor for a proper diagnosis. A mammogram and ultrasound may be needed to evaluate the cause of the lump in your armpit. A biopsy may be performed, which involves removing a small sample of tissue from the lymph node for examination under a microscope. Treatment for reactive axillary lymph nodes may depend on the underlying cause. In some cases, no treatment may be necessary, and the lymph node will return to its normal size once the underlying condition has resolved. However, the underlying condition is more serious, such as cancer. Treatment may involve surgery. It is important to note that an enlarged lymph node can be a sign of breast cancer that has spread to the lymph nodes. If you have any concerns, it is important to see your doctor straight away. What is this lump on the side of my breast? An intramural lymph node is a lymph node located within the breast tissue or on the lateral side of the chest. next to your breast. Lymph nodes are part of the body's immune system and act as filters for foreign substances such as bacteria, viruses, and cancers. Intramammary lymph nodes, or lymph nodes inside the breast, can be seen on a mammogram or breast ultrasound as small, round, or oval shaped masses within the breast tissue. They are typically less than 1 centimeter in size but can sometimes be larger, like this one, which is a reactive intramammary lymph node. While intramammary lymph nodes are not uncommon, they can sometimes be a cause of concern. In rare cases, they can be a sign of breast cancer that has spread to the lymph nodes. Your doctor may request imaging tests such as mammogram and ultrasound to evaluate the breast tissue and lymph nodes and determine the cause of the enlargement. A biopsy may be performed to determine the cause of the enlargement of the intramammary lymph node. What is this lump on the top of my breast implant? Breast implant capsular folds occur when scar tissue that forms around the breast implant becomes tight and contracts, causing the implant to move and potentially creating visible ripples or folds on the surface of the breast. Symptoms of capsular folds may include breast pain, discomfort, or a feeling of tightness or hardness in the breast. If you notice any changes in the appearance or feel of your breast implant, it's important to contact your doctor. It is important to note that capsular folds can occur in any type of breast implant, including saline and silicone implants. Regular follow-up appointments with your doctor are important to monitor the health of your breast implant and detect any potential complications early. What do I mean by malignant breast lumps? Malignant breast lumps are cancerous growths that can develop within the breast tissue. These lumps can occur in any part of the breast and can be invasive, meaning they spread beyond the initial site, or non-invasive, meaning they are contained within the breast tissue. Breast cancer is the most commonly diagnosed cancer among Australian women, 1 in 7 women being diagnosed with breast cancer by the age of 85. It is also the second leading cause of cancer-related deaths among Australian women. The most common type of malignant breast lump is invasive ductal carcinoma. Other types include invasive lobular carcinoma, inflammatory breast cancer, triple-negative breast cancer, and ductal carcinoma in situ. Ductal carcinoma in situ, or DCIS, is a non-invasive type of breast cancer that starts in the milk ducts of the breast. Invasive ductal carcinoma is the most common type of breast cancer, accounting for about 80% of all cases. It starts in the milk ducts of the breast and can invade surrounding tissue. Invasive lobular carcinoma is a type of breast cancer that starts in the milk-producing glands of the breast and can also invade surrounding tissue. Inflammatory breast cancer is a type of breast cancer that starts in the milk-producing glands of the breast and can also invade surrounding breast tissue. Triple-negative breast cancer is a type of breast cancer that does not have receptors for estrogen, progesterone, or HER2, and is often more aggressive than other types of breast cancer. It is difficult to determine by mammogram or ultrasound the definitive imaging features of each breast cancer because they all look the same. What are indeterminate breast lumps? Indeterminate breast lumps are the in between findings or equivalent findings or equivalent lumps. These determinate breast lumps are those that cannot be confidently identified as either benign or malignant based on imaging tests alone. These lumps may require further evaluation, such as a biopsy, to determine their nature. So this is an example of a fluid-filled lump with partially irregular margin, and on biopsy it is a biopsy-proven breast cancer. Sometimes an indeterminate lump may be a complex cyst or a solid lesion like this one that has some features of both benign and malignant characteristics. This is an example of a fibroadenoma-looking breast lump, which is an invasive breast cancer on biopsy. Another example of a fibroadenoma-looking lump with irregular margin, which is on biopsy, is a confirmed fibroadenoma. Some common signs and symptoms of breast cancer lumps. This is an example of a lump that is palpable. It is 4 centimeters, over 4 centimeters size, found on ultrasound. This is an example of a mammogram which shows changes in the breast size or shape. This is the normal right side, and this is the abnormal left side. You can see that the left side is smaller than the right, and this is the cancer almost occupying the entire left breast with skin thickening, nipple retraction. This is a sample of a cancerous lump invading the skin, causing skin thickening and retraction or dimpling. This example of a cancer underneath the nipple. This is the nipple, and this is the cancerous lump causing nipple retraction, skin thickening. This is the other view of the left breast, showing skin thickening, nipple retraction, and mass underneath the nipple. Breast lumps can show up on mammogram only, ultrasound only, can show up on both mammograms and ultrasound, and rarely neither on mammogram and ultrasound. And breast cancer can have different features on the mammogram and ultrasound, and it's a very complex disease. So it is important to know if there is any palpable lump or thickening in the breast, change in the size and shape, skin changes, nipple changes, nipple discharge, or pain or tenderness, because early detection of breast cancer means detecting the presence of breast cancer at an early stage before you can even feel it, before you can even see a change. This is an example of an irregular lump measuring only 5 centimeters seen on the left breast. This is an example of a cancer in the mammogram. On ultrasound showed 2 cancers. This is the largest one, showing irregular margin and spread in the lymph nodes, in the armpit, and in the neck. Early detection of breast cancer means when it is small and has not spread to other parts of the body. This is already late stage. An example case. When breast cancer is detected early, it is generally easier to treat. The chances of successful treatment and survival are higher. This is an example of a cancer not seen on the mammogram but only seen in the ultrasound. It is a patient with breast implant. There are several methods for detecting breast cancer early, including breast self-exams. Women can perform regular breast self-exams to check for any changes in their breast tissue such as lumps or thickening. Self-breast examination can be performed while lying down, while in the shower or standing, or while in the mirror. I recommend a combination of all three techniques to do self-breast exam. To download a brochure of women's and breast imaging self-breast exam, please scan this QR code, or you can visit our website. Clinical breast exam is an examination performed by your doctor to evaluate breast tissue and check for any signs of breast cancer. This is important to do, especially when you are doing your well women's check starting at age 40 onwards. Next method is the triple test for breast cancer. It is a diagnostic approach that involves 3 different types of tests to evaluate whether a breast lump or abnormality is cancerous or not. Triple test includes the clinical history and clinical breast examination, imaging tests such as mammogram and ultrasound, and a biopsy, FNA biopsy or surgical excision. There are 3 types of minimally invasive image-guided breast biopsy procedures. It can be a fine needle aspiration, a core biopsy, or a vacuum-assisted core biopsy. This is an example of a cyst being trained by a fine needle aspiration, which I showed earlier. An example of a cancerous lump being tested with a core biopsy needle, and this is a metastatic axillary lymph node, abnormal lymph node, tested and confirmed by fine needle aspiration. Another test is a mammogram-guided biopsy to evaluate suspicious calcifications in the breast. Breast lumps are a common concern for women, but most lumps are benign and not cancerous. Palpable breast lumps can be caused by a variety of factors, including cysts, fibrinomas, glandular breast tissue, and indeterminate breast lumps. Diagnostic tests such as mammogram, ultrasound, and biopsy can help determine the nature of breast lumps and guide treatment options. Early detection is critical for improving the prognosis of breast cancer and increasing the chances of successful treatment. Women should be familiar with the normal look and feel of their breasts and perform regular self-exams to detect any changes. Women should seek medical attention if they notice any changes in their breast, such as a new lump, swelling, redness, or nipple discharge. By understanding the causes and risk factors associated with breast lumps and following recommended screening guidelines, women can take proactive steps to maintain their breast health and detect any potential issues early on. At Women's in Breast Imaging, our service includes an ultrasound, mammogram, gynae scan, core biopsy, vacuum-assisted biopsy, FNA, fine needle aspiration. and ultrasound guided his aspiration. Thank you so much for listening, and I hope you learned a lot from my presentation.